Now we want to bring in ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, for more on this. A lot to get to here. Dr. Patel, both of these women say they don't have diabetes, but were advised by their doctors to take Ozempic to help with weight loss. So what do you make of the backlash they're receiving, this shaming for their own medical care, and what should people know before taking this drug?
You know, if people are facing backlash, that's a completely separate category. We don't want to be in a society where people are judging one another if they're making informed decisions with their physician. And I think that's what's important, is that anyone out there who has questions or concerns about taking a weight loss drug or weight loss management in general is having that conversation with a doctor to understand the risks and benefits of taking these particular medications and paying attention to any potential indications, side effects. And that's the track we're following, and not trying to take any medications or follow management without the guidance of a healthcare professional.
Okay, so let's move to this. Talk about a different medication being used for weight loss that's pretty popular, Wegovy. A new study says it may have added health benefits. So what does that study show?
Well, the active ingredient of Wegovy, Phil, semaglutide, has been studied in the past for its ability to have people lose weight. But this is the first of its kind to show a direct benefit to heart health. Now, this study tracked about 17,000 individuals above the age of 45 who were obese, overweight, had prior cardiovascular issues, but not diabetes over the course of 5 years, and found a 20% reduction in these major cardiovascular events, such as stroke and non-fatal heart attacks. Now, that's a really big deal because that's basically showing us that this medication, which has been shown to improve obesity, how people lose weight, now can confer a heart-healthy benefit. And so, like I mentioned, this is the first of its kind and is really opening a conversation about how we approach these drugs, and proof that lowering weight is a heart-healthy thing that everyone should be paying attention to who is at risk.
So how important could these medications be in the big picture in fighting obesity?
Well, you got the big picture right there. We'll get even farther from that and look away from these medications. This is just further proof and further evidence that obesity is linked to heart disease, and tackling obesity by any means necessary and an individualized approach is going to save lives. So we look at this study, this not only should help insurers or people really understand the importance of getting people these medications if they need it and they're having an informed conversation, but it should just further push the conversation about obesity and everything that we need to do to tackle that from a societal perspective, from these individualized meetings that people are having to insurance covering medications to public health policy.
You know, we're in an age, as you point out, where, everybody's got an opinion about something and they all put it online, and or they shame someone. However it works out, you talk about an informed decision with your doctor. Are we in a phase now where we see this, where medications that have been used for one thing are good for another thing if used healthy and in connection with your physician?
Oh, absolutely, Phil. Now, first of all, people should just understand that if you put something online, you are facing a litany of comments and things from other people, and you may not need that noise, which is why it's important to always be very discretionary about what you post online. I've heard from a lot of patients and people out there who have talked about their own weight loss journeys and have faced criticism from people for whatever reason because they're not sharing all the information. But again, if you're talking to a healthcare professional and you're paying attention to those risks, benefits, potential side effects, that's your best bet. Because there are cases out there of people taking these weight loss medications without the proper guidance, without an indication. They're doing things like sharing medications. They're getting an undesirable side effect. They're taking it for a different indication. And that's not the track we want to be on. So we want to make sure that while we tout the benefits of these medications, we also remind people that there are risks and you have to take it under proper guidance.
Absolutely. Proper guidance is the key. ABC News medical contributor, Dr. Alok Patel. Doctor, thanks so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.